Hello, the purpose of this video is to walk through the steps to safely collect, package, and ship clinical specimens for botulism neurotoxin testing for the State of Alaska Public Health Laboratory. This video is intended for use by clinicians, nurses, microbiologists, and Sendout technicians. If you are collecting specimens for botulism neurotoxin testing, the physician involved with this case has already contacted the State of Alaska Epidemiology for consultation and release of the heptavalent botulism antitoxin, or HBAT. Testing for botulism neurotoxin and the bacterium that produce the neurotoxin are performed to confirm the clinical diagnoses, not to determine patient treatment. Due to cost of testing and safety concerns, we cannot test for a differential diagnosis if the antitoxin is not given. We will cover what specimens to collect, how to collect them safely, how to package the specimens safely, how to request the tests, how to ship to the Alaska State Public Health Laboratory, and how results will be reported and what happens if botulism neurotoxin is detected. Botulism neurotoxin is extremely toxic to humans. Extreme care should be used when handling specimens that may contain botulism neurotoxin. Please use bloodborne pathogens, standard, or universal precautions when handling specimens or bodily fluids associated with potential botulism patients. Lab coat, eye protection, and gloves should always be worn. Avoid aerosolization of any specimens for botulism neurotoxin testing. If a procedure will produce an aerosol and cannot be done in the biosafety cabinet, wear a respirator that you have been fit tested for. All gloves and respirators used should be disposed of as biohazardous waste. Dispose of all contaminated waste as biohazard waste. 10% bleach can be used to decontaminate surfaces that may have made contact with botulism toxin or Clostridium botulinum. Leave bleach on for 20 to 30 minutes for spills or gross contamination. Be certain to collect blood before the antitoxin is administered. Once the antitoxin is given, it will bind any toxin in the blood and cannot be detected anymore. So the time of collection is critical. Be sure the actual time of collection appears on the blood tubes and the test request form. If labels are made after collection, or if the time the test is ordered appears on the printed label, be sure the actual time of collection is clearly marked on the tube and the test request form. For pre-antitoxin serum collection, use a red top or serum separator tubes. Draw 20 milliliters of whole blood. We need a minimum of 10 milliliters for toxin testing. When you spin to collect serum, use a clinical centrifuge with sealed rotors or wear a respirator during centrifugation, as this can create aerosols. If you must transfer serum to new tubes, do so in a biosafety cabinet to prevent inhalation of botulism toxin. Check that the actual collection time appears on the new tubes, or send the original tubes with the specimens. We are not testing post-antitoxin serum at this time. For stool, collect 10 to 50 grams as soon as possible after signs and symptoms appear. 10 grams is about the size of a walnut. Place in a sterile, leak-proof container. If possible, use collection materials designed for shipping specimens. If you must use a urine cup, seal it with parafilm so it does not leak in transit. For gastric contents, emesis, or vomit, collect about 20 milliliters in a sterile leak-proof container. Be careful to avoid aerosols during collection. If you have an unusual specimen request from a provider, please call ASPHL and EPI for more direction. Each specimen requires a test requisition form. Duplicate specimens, like 2 serum tubes drawn at the same time, are considered one specimen. The current test request forms can be found on the Alaska State Public Health Laboratory website. The forms are updated often. Be certain to use the current form. Information on specimens, packaging, and shipping can be found in the test directory on the website too. Required information is highlighted in blue, including the patient name, date of birth, collection date and time, and of course the provider information. The section for botulism neurotoxin testing is located in the bottom right-hand side. You must have contacted EPI before submission of specimens. Please add the time the HBAT was administered. Be certain the actual collection time appears on the serum tubes, as timing of the pre-antitoxin blood draw is critical. Please note that you must be certified to package and ship Category B specimens to perform the following packaging procedures. All specimens must be sealed with parafilm prior to packaging. If specimens will be transferred by courier in Anchorage, please call the Public Health Laboratory at 907-334-2100 and let us know you are sending specimens for botulism neurotoxin testing. Please call every time you will be sending the specimens. Add enough absorbent material to a Ziploc type bag to soak up the entire contents if it spills. Add the sealed and parafilmed specimen container. Seal the bag shut. Change gloves. Decontaminate the exterior of the bag if necessary. Place the test request form in the outer pocket of the sealed bag so that it will not get soiled if a leak occurs. The test request form must be packed with the specimen, not just in the shipment for the courier. Keep the specimens cool. Place bag in a rigid plastic container with the UN 3373 label and proper shipping name on the outside. If specimens are routed through another healthcare facility, be certain the original test request forms are with the specimen. Do not repackage any specimens. Do not add labels that obscure the original label from the hospital of origin. Call the Public Health Lab to alert us to specimens coming in for botulism neurotoxin testing. If you are packaging the specimen for air transport, make sure that you are certified to package and ship Category B. Package the same way as above into the initial Ziploc bag. Change gloves at this point to prevent contamination of the second bag. Place the first bag in a second bag designed for shipping. The biohazard emblem must appear on the packaging. Place the test request form in the outer pocket of the second bag so it will not get soiled if a leak occurs. The test request form must be packed with the specimen, not just in the box. Keep the specimens cool. Place specimens in an insulated box for Category B shipping. Add more absorbent material or padding to prevent breakage during shipping. Use wet ice to keep specimens cool. Do not freeze. Do not ship specimens for botulism neurotoxin testing with any samples submitted for any other testing procedures. A spill will mean that all samples are compromised. You are shipping as a Category B level for diagnostic materials under DOT and IATA regulations. The UN 3373 emblem and the proper shipping name must be visible on the box. Tape box securely. Do not label the outside of the box as botulism or Clostridium botulinum. Ship to the address on the screen. Please make sure to note special pathogens on the outside of the box. Remember to call the Public Health Lab to let us know a package is on the way. Please provide the airway bill number and carrier information. Decontaminate all surfaces and areas that may have botulism neurotoxin on them with 10% bleach or equivalent. Allow a minimum contact time of 5 minutes for the 10% bleach or as required for other products. Dispose of PPE, collection, and decontamination materials as biohazard waste. All persons involved with specimen collection or packaging should be aware of the toxicity of botulism toxin. Observation for potential exposed individuals is recommended for 2 to 4 days for signs and symptoms of blurred and double vision, dry mouth, slurred speech, and peripheral muscle weakness. Report potential exposures to the State of Alaska Epidemiology immediately. Testing for botulism neurotoxin at the Public Health Lab will generate a presumptive result in about 1 week. Often we are waiting for additional specimens or food samples to arrive. Confirmation of results may take 1 month. Initial presumptive positive results will be reported by phone to the submitter or laboratory listed on the request form. Negative results will be faxed or mailed. Confirmed positive results for botulism neurotoxin or Clostridium botulinum require an APHIS CDC Form 4, reporting the identification of a select agent or toxin from a clinical or diagnostic specimen to be generated by the Public Health Lab and completed by your lab director within 24 hours. Botulism toxin and Clostridium botulinum are on the Tier 1 list for select agents and toxins. You need to destroy all specimens that could contain toxin or organisms within 7 days of notice. You will need to note all personnel that were involved with this case and determine if there was an exposure. Don't forget your Sendout staff if your packaging is routed through them. Any exposures and treatments for exposure will require completion of an APHIS CDC Form 3, Report of Theft, Loss, or Release of Select Agents and Toxins for accidental release. Accidental release is the term the CDC uses for exposure. If you suspect exposures, call epidemiology immediately. You can access Form 3 at www.selectagents.gov. If you have any questions, please contact the Public Health Laboratory or Epidemiology for clarification. As a reminder, the Public Health Laboratory website has both the test directory and test requisition forms on it.